ADEC's Smart Start program offers first-time practice owners their deepest discounts on equipment and furniture for 2 years, plus other savings and complimentary services. Ask your ADEC rep for details and start smart with ADEC. Join Doctors Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry. All right, welcome back to another episode of Beyond Graduation. I'm Savanah Craig, and with me as always,
I'm Ronnetta Sartor.
All right, Ronnetta, is dentistry the weirdest career?
I would have to say it's pretty darn weird. It's pretty weird.
I think I've been thinking about this for a long time because I feel like people know dentists and have been to the dentist, but even still, they have no idea what we're doing. Like, oh, I've had a filling, or people who have never had any restorative dental work, they just think we pop in every, for 5 seconds.
Yeah, that's true. Or that I've had a lot of people that's like, oh, you're a dentist. You clean teeth.
Yes.
For a living. So, like, some people have no idea, like, that a hygienist is the ones that... Well, I think to be fair, I think there are some dentists that don't have hygienists and clean teeth. So I think we just confuse patients all over.
We do this to ourselves, I think, because you can do dentistry so many different ways.
This is true.
So, yeah, my practice is different than your practice, but we both are general dentists.
It's very true. But yeah, I think it gets confusing too, because I think both of us are kind of trained to do a lot of things that just general dentists don't do.
Yes, that's the other piece of, like, there are specialists, but also you can do specialty procedures, but not all of them, but some of them. And teeth themselves are an enigma of, like, my tooth hurt for a while and then it stopped hurting, so it must be better. And you're like, actually, it's worse.
Yes. Where's the drums? Dun, dun, dun.
Yes.
Yes.
Like, that means it's actually dead. Okay, so how do you, like, think back to dental school? Did you know what you were getting into?
Oh my gosh. Literally, probably 2 days ago, I was having a conversation with my classmate from dental school, actually. And we were talking about how it seems like in some aspects we were sold a dream in dental school.
Correct.
About what dentistry is and was.
And could be.
And could be, right? I think one thing that I 100% agree with is that we're in a great profession. It's a great profession for so many different reasons. Like, we get to help people. We get to help people, like, from a health wise, but from a confidence wise as well, and an aesthetic wise. I think what I was getting at with my my friend was that it's so many nuances to dentistry. Like, I think that day I saw on social media, a dentist went viral because she said, I'm a dentist and I'm broke. I live paycheck to paycheck.
Yeah.
And the internet was, like, going crazy because they're like, how can this be? But I think too, like, a lot of our professors in dental school, the dentists, the profession of dentistry that they inherited is completely different than what we have inherited.
Yes.
Like, student loans, a lot of them pretty much got a loan from the bank and, pay that off, or they were able to work and, left without any like loans at all.
Yeah. The debt to income ratio was vastly different in whatever 70s.
Right. And so, like, now a lot of dentists need things like income driven repayment in order to be able to afford to pay their student loans and a lifestyle. So what's your take on it?
No, I totally agree with you. I think we've talked before of, like, the reason I was attracted to dentistry is it seemed very like A plus B equals C. There's a cavity, drill it out, put a filling in, you're good to go. And it's not that at all.
I think that's what makes it such a great profession, though. Like, because it's constantly evolving, right?
Yes.
Like, I know in school they kind of talked about the evolution of it and how it was like, you have a problem, you fix it. And then it went from before you have a problem, like with Carrie's risk assessments and that sort
Yeah.
of thing, let's try to be more on a preventative side of it so that we can prevent problems, because once you have a problem, eventually at some point, because we're not God and we're not like replacing like with a brand new tooth, that you naturally had, at some point you'll have to have something redone or something like that. And I do think that dentistry has evolved to start including more of the health problems and how that impacts the mouth and the overall body.
Yeah. I think we should definitely circle back to dentistry and the overall body and how that also makes dentistry the weirdest career, because for some reason we've separated it from the body. But I think talking about the viral video of like dentists aren't as financially, not all dentists, not all people are not as financially wealthy as people assume we are. Let's talk about how our dentists paid, because I think this was the most shocking discovery to me. I honestly don't know if I realized truly production collections and like percentage of that until I was like looking at job contracts.
I agree
Like I
100%.
had heard those words, but I don't, or like daily guarantees, daily minimums. Like, let's just get into it, because I think when I talk to my friends who are not in the dental field, they are shocked at actually how we make money. And also, it's going to be different how you make money as a practice owner versus how I make money as an associate.
Very true. So I guess let's start, because you threw out a lot of those terms. So it's fresh in your mind. Let's talk about it.
All right. So, production at the most basic level is the amount of money your office says a procedure should cost. Do you think that's the most reasonable way to say that?
Right. So for an example, for today, if you add all of the procedures you did and it equals, for example, $10,000, that's what was produced that day.
Yes. So, one crown equals $1,500, one filling equals $200, whatever. In a perfect world, you would get paid on those fees that your office says a crown costs us in electricity, labor, lab fees. We have, because it's a business, don't forget it's a business, we have to charge a patient $1,500 for a crown. Just like I paid $10 for this coffee mug because it cost these people money to make this coffee mug. However, depending on your business model, collections are what you actually get paid for that procedure. Do you think that sums it up?
Yes. So what that would mean is, for example, if on this day the crown that's $1,500, if you are in network with an insurance company and the crown costs only $900, then pretty much give or take, you may or may not, like if your patient's paying, give or take, that you won't collect that whole thing, if that makes
Yes.
sense,
Yes.
on
So,
that day, because you have to submit it to insurance and then wait on their payment. All you may collect that day, for example, is maybe $400, which was the patient's portion for
yes.
that specific procedure.
Yes. So, most offices, and then, I mean, adjusted production, we're not going down that rabbit hole because those are made up. Anyway, so I am paid a percentage of collections because as a business that my boss is running, he cannot pay me a percentage of an imaginary number.
And see, when I was an associate, it was the opposite. I was paid on production.
Ooh, okay.
So I was paid on production, but I agree, now being a business owner,
Ooh, oh, it's
it's
changed.
yeah, it's really difficult, to pay someone on something that you may or may not have collected. So it becomes a situation where your team and communication has to be excellent. Like communicating with the patient that this is due on this day, communicating with the insurance companies to submit the claim, actually making sure that insurance pays that claim, and
Writing narratives if they don't want to pay that claim.
Exactly.
Yeah. And so ideally, your collection and production eventually should be 100%, like for the year in a perfect world. It's not, because patients may get sent to a collection company because they're not paying their bills on time. Insurance might deny a claim and then you have to write it off. There are a lot of ways that the money doesn't line up.
You told a good story earlier. You was talking about like a family member that is a mechanic,
Yes.
and the similarities between the two, which I thought was a pretty interesting correlation.
Yeah. So my husband's cousin is a mechanic, and at like all family functions, you end up like breaking off whatever, and over time like we bond because it's very similar. The experiences that he has with customers and that I have with patients, of like, people are either coming to you for preventive maintenance, ideally, oil changes, the wiper fluid. I'm not a car girl. I don't know what things your car needs, but it needs regular things. Tire chain rotation. Yes. But if you don't go for your regular maintenance, then things break and then you have problems. And it's not the mechanic's fault that you didn't go get your oil changed, just like it's not necessarily my fault you didn't come for your regular cleanings. But so it's become very similar, or he will talk about like, people know there are problems and then he diagnoses the problem, but they don't want to pay for the solution and get mad that it costs money. And he's like, okay, I have to keep my shop open. I have to pay my employees. I have to buy the oil and the oil filters, and I can't, like, it's not a one-to-one. If I bought the oil filters for, how much are oil filters? I don't know. The
I
whole
have no
thing,
clue.
$50. I don't know.
Yeah.
Don't come for me, mechanics. If he has to pay $50 for the supplies to do the thing, he can't charge you $50 because then he's breaking even, and that's not how businesses work. And that's also very, like, okay, dentistry is the same thing. People just come because they have this problem, or sometimes you don't know your car has a problem. I don't know what noises my car is supposed to make or not supposed to make.
That's true.
And that's why I go to an expert, a mechanic, to tell me if everything is good. And people come to the dentist not knowing they have problems, and then we have to tell them, hey, you have a problem. And they don't like that because they're like, I thought everything was fine. This doesn't hurt, or it did hurt and now it doesn't hurt anymore. And you're like, well, it doesn't hurt anymore because it's so infected, your tooth has died, and now we either have to do a root canal or an extraction. And this friend of mine who's a mechanic will say, there are times where people are like, my car made this noise and then it stopped making this noise, and so I didn't bring it in, but it's actually not good that it stopped making the noise, or like,
Right.
and so we really vibe about it. And it's always funny at family functions because there are like doctors and nurses in the family, and everybody thinks like they get what I go through, but they don't. And so like we'll start talking and everyone's like, your jobs are so weird. And then the other thing we'll always get into is like Google reviews.
Oh yeah.
People aren't Google reviewing usually like their anesthesiologist at the hospital.
That's a great point. But also, kind of to your point, if a patient goes because they were having heart palpitations or something like that, and they say, hey, you have a blockage, you need surgery, that's automatic. Now, in very few cases will someone die from, anything dental related. There are cases where people have, for sure.
Mm-hmm.
But if we say, hey, your tooth is abscess, it's not met with the same urgency as a lot of other medical conditions is. Because like you said, it's like, well, it's not hurting now, so I don't want to do anything until it's hurting. So it'll be great for like as a profession us to create the same type of urgency that I think medicine does in getting patients to move forward with treatment.
Yeah, I don't know. I feel like in some ways it's like normalized. sometimes, like tooth pain and tooth problems. And again, that could be a whole other conversation, but like, and I don't know that I truly on a logical level knew how bad dental infections could be until I did a residency too.
Yeah, because then you see the cases where people are in the hospital on IV antibiotics for this infection,
Yeah.
and we have to take them to the OR because if not, they may not survive. Or, because we work very closely with the heart hospital, there's a patient that needs an LVAD, and before doing it, we need to get all these bad teeth out so that the teeth don't infect the newly placed, things in the heart.
It's all
But
connected.
I know, but it's really tough too, because like
Yes.
when you say certain stuff like that to some, because I have a lot of older patients and a lot of them do have heart issues, and so if I find anything like that, I'm like, listen, you've got all these things going on with your heart. You do not want this tooth to cause anything to go wrong with that or in any other part of your body. Like, we need to get it taken care of.
Totally.
Yeah.
And it's an uphill battle because even we have separated dentistry and medicine so much. And there are times where like our medical colleagues don't understand the severity and like how dental health impacts the rest of the body. And it's not their fault. They don't have a lot of lectures. One of my best friends is a physician, and we were in med school and dental school at similar times, and the amount of like full body anatomy, physiology, pathology that we took compared to dental specific lectures that they got over like 2 hours their entire 4 years is baffling to me. That's a podcast for another time.
Oh, yeah.
Okay, circle back with me to why some dentists are living paycheck to paycheck and can't pay their loans and how that could even be possible. Aren't we all buying boats and yachts? Yeah, yachts are boats. Mercedes and yachts and beach houses.
Yeah, it's tough. I think there is a population of dentists out there that are, but I think a lot of us baby dentists, less than 10 years out, we're trying to figure it out, how to put all of the pieces together.
Yeah. I mean, part of it is insurance reimbursements. Part of it is student loans. Part of it is a lot of us don't have consistent paychecks because of this production collections thing. And I mean, for you, right? Like you're partially the owner, partially the employee. So like how much goes into the business? How much goes into your pocket? There's so many ways to do this.
And as a practice owner, you have a team that depend on you in the practice, and you want to make sure that them and their family eats, but also at the same time, to your point about your cousin that's a mechanic, I have to make sure that me and my family eat too, but also that the practice has everything that it needs to run. And yes, it's interesting for sure.
We wear many hats.
For sure.
And nobody knows about most of them.
Well, guys, we are super interested in hearing how dentistry is weird and some correlations of dentistry to other professions if you have them. So reach out to us and let us know. We'd love to hear from you.
We'll catch you back next time.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr._Sartor. And remember, you are not alone on this journey.
ADEC certified pre-owned equipment is a sustainable, affordable choice that makes genuine ADEC equipment available to every doctor. Each package is sold on a first-come, first-served basis. So, if you see one you like, contact your dealer. For more information, go to www.adec.com/find a dealer. Thank you for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists. This episode was sponsored by Ignite DDS Coaching. We build self-determined futures. For more information, please reach out to the Ignite DDS team.